Hi, everyone. I'm Drew,
And my name's Kishan.
and thank you for joining us today. World HIV/AIDS Day is a time to recognize the disparities in access, fight stigma, take action, and honor the lives lost, and also to recognize those who have supported breakthroughs in treatment and providing care.
Today, we're going to discuss what HIV and AIDS is, HIV in a global context, what treatment and prevention look like in 2023, challenges, the future, and what pharmacists can do to get involved.
Yeah, so to get things started, Kishan, what is HIV?
Yeah, so HIV is a virus that can be transmitted through sexual contact or through needles or through pregnancy to the fetus. And it is a virus that weakens a person's immune system. When a person's immune system weakens, that makes it easier for them to get other infections unrelated to HIV.
So if somebody has HIV, how can that be transmitted to someone else? What are
Yeah,
the pathways for that?
so the most common pathways for HIV to be transmitted is typically through bodily fluids. Those can include things like blood, semen, rectal fluids, vaginal fluids, or even breast milk.
So if somebody has HIV, does that person automatically have AIDS?
So HIV is the virus itself. AIDS is actually a stage of the infection of HIV if HIV is to progress. Once HIV progresses far enough, a person's immune system is so weak that it makes them prone to things that would not normally make the average human being sick. And at that point, we call it AIDS.
Yeah, so things of so different types of infections that are referred to as AIDS-defining illnesses. And generally speaking, the typical way to measure that is through CD4 count. So if it's below, our immune cells are below a certain level, so either the person's presenting with these illnesses, or if their CD4 count is below a certain level, that's when they would have an AIDS assessment at that point.
Exactly.
So they're not exactly the same.
Hmm.
Okay. So, what does HIV look like in a 2023 global context?
Yeah, so that's a good question, Andrew. Today, actually, around 40 million people worldwide are living with HIV. Amongst these individuals, 30 million people are accessing treatment for HIV. Additionally, 1 million people have acquired HIV, and unfortunately, 600,000 people at least have passed away from AIDS-related illnesses.
Yeah, so there's still obviously significant gaps in care and in treatment that exists. You said 40 million people, in 2022 were living with HIV, and only 30 million were on treatment. So there's a
Hmm.
big gap there of people who are not accessing the care they need. So, as we know, HIV can affect anyone, can affect people of all backgrounds, can affect adults, children. So when we look at those 600,000 folks who passed away in 2022 from AIDS-related illnesses, that's, across the board.
It is. It's a really large disparity. And something really alarming is that 1 out of 7 individuals living with HIV are not aware of their status, which means that there's still a lot of work to be done in people being able to access testing and treatment.
Yeah, so even though there's been dramatic improvements in detection and screening and drug therapy options, since like the 80s and 90s, there's still, work to be done. And, those 1 in 7 people living with HIV, they're not on treatment, the kind of progression of HIV, and it also is an opportunity for them to transmit it to others without knowing that they have HIV as well.
So when it comes to transmission of HIV and communities that are highly impacted, what do you know about the people that are most likely to be affected in a global context?
So, I mean, it ranges from country to country, but there is, we do know that there are higher risk groups. One group potentially is gay, bisexual men who have sex with men, although I always say that with a bit of caution because we do know that HIV affects everyone. 53% of people in the world living with HIV are actually women and girls. But it is important to be mindful of, there are some groups, even among different racial backgrounds and ethnicities, we see variation, specifically individuals who are Black, Indigenous, and some folks who are people of color can also be at higher risk categories. So it's, it's that intersectionality of, where somebody lives, what their background is, maybe possibly their socioeconomic factors, and all those kind of play a role into risk stratification.
Yeah, that's very interesting to know. I feel like in modern day context, people usually imagine what HIV looks like and who typically is affected. But when we put all these facts into perspective, it really does impact a larger portion of the world.
Yeah, I mean, 1 in 4 new infections right now are in women, and we know that the majority of new infections in a lot of regions is actually among heterosexual individuals. So definitely, frames our perspective a little bit different and what people, have assumptions about. Now we're looking at, treatment and options for folks. What does that look like in 2023? What options are available? How are we tackling treatment?
Yeah, so actually, really great question because treatment for HIV started off as being something that was very novel, but also it came with large risks when it came to side effects. It also meant taking a lot of different pills every day, and it quite significantly did impact people living with HIV, in terms of how much they needed to pay attention to their health. Today, we are fortunate enough to have advanced scientifically to have single pill solutions that contain multiple different HIV medications in a single pill. And by taking just one pill a day or multiple pills a day, you can treat HIV such that the viral load in your body for the virus is at an undetectable level.
Yeah, so it's we look at it now, I think in pharmacy, healthcare perspectives, treating like hypertension or diabetes, where someone goes on a pill, we're monitoring them and they just kind of carry on. So people now in 2023, if they're on effective treatment, they can live long, healthy lives. We're not dealing with those, taking 20 pills a day or those toxicities of older medications. So how effective is treatment and is there a cure?
Good question, Andrew. So, unfortunately, there's no cure for HIV, but fortunately, there is very effective treatment. The goal of therapy with treatment is actually to attain undetectable levels of HIV in the body. When the levels of HIV are undetectable, it means that the tests cannot detect HIV, and a person living with HIV is unable to transmit HIV to another individual. So undetectable is equal to untransmittable. That is a very important phrase that I would want everyone to know about.
Yeah, so things like through sexual activity and also through pregnancy as well. So it's ultimately, the goal of therapy. We want folks to get there. However, if somebody is not undetectable, everyone, no matter their level of virus, is valid and worthy, and we try our best to help folks with that. For some patients, it's going to be a lot easier to get their viral undetectable, especially somebody newly diagnosed that has had a more recent infection versus somebody who maybe, has been on multiple drug regimens, or there's been adherence issues, or there's been a long duration of the living with HIV without drug therapy. The other thing is, so, with that being the case, we look into talking about treatment. We also get into prevention because essentially somebody living with HIV who is on treatment, that is a tool for preventing transmission because that person, once they're on treatment and it's effective, they can't pass it to a partner. So that's known as treatment as prevention. But what are some other ways that we can prevent HIV transmission?
There are actually quite a few effective ways of reducing the risk of HIV transmission. One of the first things I want to mention is actually PEP. PEP, known as post-exposure prophylaxis, is used to reduce the risk of HIV after being exposed potentially to HIV. This is a medication regimen that is typically given over a course of 28 days, and a person would then go in for repeat testing to see how effective the medication was for their scenario.
So in our clinic space, we work with a lot of PrEP. Can you share with folks a little bit more about that?
Yeah, sure. So PrEP stands for pre-exposure prophylaxis. Slightly different from PEP because this is something that is taken before potentially being exposed to HIV. Now, PrEP is a medication that is typically just a single tablet, and it is taken as a single tablet every day to help reduce the risk of HIV by up to 99%.
So it's really, really highly effective. And it's really important that, in our healthcare space that we're really advocating for our patients that have access to it, that we're spreading the word about it. Even in our context where we live in Ontario, Canada, 1 in 10 people who could benefit from PrEP were on it. So that's a big gap, and it really comes down to awareness and breaking down barriers to access. What are some other ways of prevention?
Yeah, so we have non-medicinal ways of preventing HIV as well. One that is very common is obviously condoms. They help reduce the risk of HIV, but also other STIs. We also have testing. Now, testing in a regular way through routine blood work, but also as rapid HIV tests, which can help detect HIV in a more acute setting. We also have needle exchange programs, as well as pre and postnatal screening, which vary depending on which country, which region, which city you may live in.
Yeah, it's definitely really important that individuals who are pregnant are being screened for HIV. Ultimately, you want to get somebody who is living with HIV on treatment as soon as possible to prevent that transmission to their fetus or baby. One other thing too, just in terms of PrEP, healthcare professionals often want to know is like who is a candidate for PrEP and who should we be encouraging and who should we be targeting. There's a wide criteria, but some considerations include having a sexually transmitted infection in the last 6 months, especially if they've had syphilis or rectal or chlamydia or gonorrhea. If somebody is being sexually active with a partner and they don't know their status 100%, if a person has recently needed to access that emergency PEP, if somebody is, doing injection drug use or sharing drug paraphernalia, that would be another potential consideration. So outside of that, what are some challenges in navigating, treatment and prevention for HIV?
Yeah, so to this day, still, we do have barriers with accessing care to reduce the risk of HIV. Now, one of those major ones is cost. Depending on where one may be living, there may be coverage for certain medications, certain types of testing. Certain people may not actually have those things available to begin with. Not even having a healthcare provider would be a huge barrier to care as well. Now, is there anything else that you think would be preventing people from getting the care that they need?
Yeah, I think those are good points in terms of cost and accessibility of care providers. Also, a big one is stigma.
Mm-hmm.
So individuals who, they face stigma in their communities or they have internalized stigma may be scared to get tested. They may be fearful to come out with their diagnosis or to access care or to, let people know because there are some places where people have had, hostility against their diagnosis, and some places even the state itself, has restrictions. A big focus right now is on decriminalization relating to HIV disclosure and what that looks like, regionally in different places. And also when people are in a country, or let's say they're visiting or they move to a new country and they get an HIV diagnosis there and possibly have threats of things like deportation. So a lot of this, feeds into a lot of the negativity. One thing a lot of patients have told me, and this has come up many times, is I've heard HIV is the virus, stigma is the disease. So while, once people do have access, once that hurdle is met and they are on treatment, they access care, what happens after that in their day-to-day life? What happens with their interactions with others? And that's why things like U equals U is so important because, people who before thought they couldn't, have relationships or interact with folks or, feared that, that's one less thing that they have to be thinking about. So it's really important in our space as healthcare providers that we are really fighting ignorance, that we are providing education, that we're really spreading these messages because the messages you send out to others is what is actually going to help fight stigma in your local communities. Other than that, we talked about treatment and we talked about global context and everything in 2023. But what about, moving forward? What does it look like for HIV in 10 years, 20 years? What is that going to look like?
Yeah, so actually, HIV is a disease that we've been fighting in many different ways throughout the years. And now, actually, what we're looking into is a vaccine to help prevent the spread of HIV. This would work similarly to other vaccines that we have to reduce the risk of certain viruses. We also are looking into injectable versions of PrEP Now, in this current day and age, we actually do have an injectable version of HIV treatment regimen, but we're also looking into the same thing for as a preventative measure. It's not available in most countries yet, but I'm hoping that it is available soon for many people in need. We also have new HIV medications that are being developed that are targeting new ways of preventing HIV from being spread or replicating in the body. This is particularly very useful in cases where there are resistance or mechanisms through which HIV is not treatable through currently existing medication. And finally, do you think there's anything else that we as pharmacists can do?
Yeah, I think pharmacists have a really pivotal role. With our clinic specifically, pharmacists are really the hub. We really navigate our patients through the clinic experience. We connect them with PrEP and HIV treatment. And I really encourage folks to, do their own research and really try to learn more. When I graduated, back in the day, we didn't learn a lot about HIV. I had to do a lot of self-learning. And what I came across for myself was the American Academy of HIV Medicine. They have a program for certified HIV pharmacists, which I've completed and Kishan has as well. And it provides kind of a training guideline and resources for you to really specialize in this space. And even if you aren't going to go through that process, just looking at regional, local guidelines, CDC has guidelines, the NIH in the US has guidelines, just to be familiar with different things, and not just with, you know, the treatment and the prevention specifically, but even the associated things. So somebody who, is living with HIV or has progressed to AIDS may be on, medications for, you know, opportunistic infection prophylaxis, so prevention for those things. Or a person living with HIV, is going to have other chronic conditions like anyone, like everyone else, like diabetes and hypertension and different things, or even, cancer. And what does it look like to be living with HIV and also be, navigating other chronic health conditions or other health challenges?
Thank you so much for sharing, Andrew, and thank you all today for tuning in.
Yeah, thank you, everyone. We hope everyone takes care and we'll be in touch.